Actress Shannen Doherty recently revealed that her breast cancer has now spread to her brain.
Dr. Shariq Khwaja, radiation oncologist with UT Health Houston and Memorial Hermann, joins us to talk about the potential cancers that have spread and go to the brain. Good morning. Thank you for being here.
Thank you so much for having me.
It's a tough conversation, but I feel like ones like this can really open up this conversation to make sure people are well educated about it. It seems like a lot of times when we talk about cancer spreading, I think people think more about the lungs, maybe the bones perhaps. How common is it for any type of cancer to spread to the brain?
Well, there are certain cancers that have a predilection to going to the brain. Breast cancer is one of them. Lung cancer is another one. Melanoma. So I think that at the end of the day, it's a matter of understanding, your type of cancer and what your risks are. And so this is a discussion that you have to have with your oncology team.
Oh, for sure. So talk about some of the signs and symptoms that may indicate your cancer has spread to the brain.
The brain is a very complex organ, as we know, and controls everything. And for some patients, it's just a mild headache that's persistent. For some patients, it's seizures. So really, we're looking at any neurologic changes. And that could also include a change in your gait, change in your strength in one side or the other.
What comes into this when you do have cancer? Does this include regular screenings? Does it just mean keeping a close eye on how you feel and any of those symptoms you mentioned?
Absolutely. And there's a difference between screening and surveillance. And for patients that have been diagnosed with cancer, it's a matter of regular surveillance. So that can involve just regular physical exams, regular follow-ups with your oncologist. Sometimes that includes CT scans or MRIs.
And is there a specific age that these screenings should start?
No. Once you've been diagnosed with cancer, as in Ms. Doherty's case, she's been under constant surveillance. And so in her case, likely there was some sort of neurologic sign that ultimately resulted in getting a brain scan, which eventually resulted in her getting radiation treatments.
Yeah, how much more difficult does it make it to fight cancer when it starts spreading to another major organ like the brain?
You go from unfortunately, a curative situation to a stage 4, which is technically non-curative. And in that case, you're really trying to control the disease rather than cure it.
And what kind of treatment is available for those who have, noticed it early on, perhaps that it had spread to the brain?
Absolutely. There's lots of ways to do treatment for tumors that have gone to the brain. Surgery obviously is one option. Radiation therapy is another option, and then there are some targeted, what we call systemic or drugs that go to the whole body, including the brain. In Ms. Doherty's case, she's getting radiation treatment. I don't know exactly the specific type, but there's whole brain radiation that as the name implies, goes to the whole brain, and then there's gamma knife, which is a very specific way to target certain lesions in the brain.
You're such a calming soul. I feel like you got to be so good, such a good feeling for your patients. Thanks for taking time from UT Health and Memorial Hermann to come in and talk to us today, Dr. Khwaja. Our honor.
Thank you so much.
Thank you.